Good morning, class. Today we're going to talk about coding and documentation for metastatic cancer with the help of our very own stunt mouse, Mortimer. Word, I am sorry. Mortimer and apparently Jerome, our IT guy, have a morbid sense of humor. See me after, Jerome. Now, it is important to note that one cannot code a cancer without knowing whether it is an active cancer, or a personal history of, and whether it is the primary site or the secondary site. Now, we will address active cancer versus personal history of in another lecture. Today is reserved for primary versus secondary cancers. The statement metastatic to indicates that the site mentioned is the secondary site. For example, a diagnosis of metastatic carcinoma to the lung is documented and coded as secondary malignant neoplasm of the lung. A code for the primary neoplastic site should always be assigned when the primary neoplasm is still present in addition to the metastatic to site code. Additionally, and never to be forgotten, any active cancer is further supported by a statement that describes either the current treatment of it or the refusal of treatment. Now, what happens when the primary site has been eradicated and yet there is metastatic disease in play, you may ask? Well, when the primary neoplasm has been excised or eradicated, it is documented as a personal history of whatever cancer and a history code from the Z category. Personal history of malignant neoplasm should be assigned. The statement metastatic from indicates that the site mentioned is the primary site. For example, a diagnosis of metastatic carcinoma from the kidney indicates that the kidney is the primary site, and then you would indicate where it metastasized to, and then document the secondary site. Both the primary and secondary sites and diagnoses need to be documented and coded as long as the disease is actively being treated or treatment has been refused. Now, please do document that the patient has metastases at the time of the visit and is receiving treatment or is refusing treatment by choice. The diagnosis must be able to stand alone per the date of service or encounter. Also remember, if treatment is directed at metastatic disease, the site of metastases are used as the principal diagnosis, and the primary site becomes the secondary diagnosis. If the metastatic disease has been treated and there is no current indication of disease, use the appropriate Z code for history of. Last, don't confuse personal history with in remission. Aha! Now that's more like it, Mortimer. Class dismissed.
These links will take you to the ICD-10 CM guidelines, the 2017 crosswalk of codes to HCC and RxHCC categories, and to the most current listing of ICD-10 CM codes on the CMS site. Please feel free to muck about in them for clarification and further edification.